And welcome everyone. I am Kristy Jones. I'm a community health director with Intermountain Health. And Intermountain Health has a footprint in Utah, southern Idaho, the Clark County, Nevada area, and then in Montana and Colorado. And so I'm really excited to be here. I do a lot of work in my role around suicide prevention efforts. And so I was asked to talk a little bit about firearm safety regarding suicide prevention. So I will just go ahead and dive right in. I appreciate the invitation to be here and everyone joining in today. So just a warning that we are talking about suicide and we are talking about firearms. And if anyone is triggered by this in any way, make sure you let the moderator know and they can help you. But I just want to put that little warning out there before we move forward. So want to share kind of what I'm going to cover today. Want to talk about the data. I am not a data analyst, but I love data. I'm a bit of a data geek. So we're going to look at what the data is showing us. We'll talk about why discussing lethal means for suicide prevention matters and how we can protect one another and how we can help people get help. So with that quick overview, let's go ahead and dive into the data portion of this and we can move forward. So the most recent mortality data that we have is from 2022. They're still working on the 2023 data. And so this chart comes from the Centers for Disease Control and Prevention. And this shows firearm mortality in the United States by state. The darker the red or orange, the higher the rate of firearm deaths. So you can see the dark color, which is these two states here, they have the highest rate of firearm deaths. So you can see in the Intermountain West, we vary quite a bit. And I understand there's folks from all over the United States, but the bulk of you are in the Intermountain West. So you can kind of get a feel for what it looks like in the states in which you are living around firearm mortality. And if anyone has any questions about the data, I've included links to the data in the slide deck, and the organizers can help get you that information if you're interested in it. So this graph is a little bit pixelated, and I apologize, but we want to look at gun-related deaths by type of death. So as we look at this, I want to share that there were 48,204 gun-related deaths in the United States in 2022. So of those, the large green section, 56% were attributed to firearms. Another data source said 55%, but it's really 55.6 ... And so this one rounded up. So 27,000 firearm deaths were attributed to suicide. And if we take a step back, every single suicide death is one death too many. So when we're talking about 27,000 people who were lost in 2022 to suicide, it's just heartbreaking. And then the next big category is that light blue. That is homicide. So 41% of the firearm related deaths in the United States were homicide, and that's just under 20,000 at 19,651. And then we have these itty bitty categories: legal intervention, undetermined, unpreventable, or accidental. They're each around 1%, but 643 deaths due to legal intervention, 415, the intent or the cause was undetermined, and then 463 were considered preventable or accidental deaths. And again, heartbreaking to see the number of people lost. To me, every loss, whether it's suicide, homicide, accidental, it's just too many. I couldn't make this graph change colors. so that it was easier to read. This is suicide deaths over the years related to firearms, and then all others. So other is the round circles, firearms is the square. And you can see that they are both increasing as we move forward. And firearms, and other firearms are outpacing all of the other causes. And when you think about firearms and what they're doing and how they're outpacing the other method, we're really looking at the fact that when firearms are used in a suicide death, they're fast and they're lethal. So let me move on to the next slide. I'm sorry that this one is not a perfect graph. I played with it and couldn't get it to change. So because so many of you are in the Intermountain West, I wanted to add a slide showing for not every, but the bulk of the states in the Intermountain West, what percent of suicide deaths in those states were attributable to firearms. So you can see Colorado, 53%, so they're under the national average. Idaho and Montana, Nevada, they're all over the national average. It's a bit concerning, but we also are looking in the Intermountain West. I hear people say, we are a hunting culture. There is a lot more access to firearms due to people being hunters. And so whether that's why this is higher or not is undetermined at this time. So I want to switch gears off of the data, and I want to talk a little bit about how we do suicide prevention with lethal means restriction. So let me move on to the next slide. As we look at this, time and distance are so important, and especially when we're talking about firearms as the most lethal method of attempting and then dying by suicide. So if we can put that time and distance between a person who's in a suicidal crisis and a firearm, we have the opportunity to save a life. And I want to clarify, I'm not talking about taking away anyone's Second Amendment rights. This is not a political issue. This is a safety issue, and it's really designed to help keep people safe. So some of the questions and pushback that we hear, won't they just substitute another method? And the majority of times, no, another method won't be substituted. Once somebody has that plan in place, they typically stick with that method and that plan. So really, any other method is not nearly as lethal as the firearm. And it may cause people to delay an attempt, but either way, if we can help put that time and distance between a firearm and someone in crisis, their odds of survival will go way up. So why are we talking about this? Because suicidal crises are often very brief. Somebody may have suicidal ideation for a long period of time, but that actual crisis where they are ready to make the action is very brief. And I've already mentioned this, but the deadliness of an attempt depends on the method used. And we know that firearms are the absolute most lethal. And we also know that 90% of individuals who attempt suicide do not go on to die by suicide in the future. So if we can save a life now, we've saved it into the future. So suicidal crises are often very brief, as I mentioned. So I wanted to share this data of a study that was done where they surveyed people who were admitted to a hospital after a suicide attempt, and they were asked how long they had been thinking about suicide before the attempt. And 48% said 10 minutes or less, 24% were 5 minutes or less, and then 24% were 10 minutes or less. So combined, it's 48%. So you can see that this is a really critical time. And if they don't have access to the firearm, we can make that intervention work. And so I want to talk about strategies for how we can protect each other. And I'm focusing on firearms, but if you have somebody that you're aware of who has suicidal ideation, And especially if they've shared their method and they want to do poisoning or some other method, you can definitely secure a safe to lock up medications. You can be the one to administer medications. If they have daily medications, you can give them to them at the time that they're needed. So don't think that we're not caring about the other methods, but we really want to focus on this firearms today because they are so deadly. So as we look about protecting one another, this picture I included is a cable style gun lock. It's a very simple strategy. It's one of the first lines of defense that you can use because we know that having access to a firearm during a suicidal crisis increases the odds that the attempter will die. And really, the idea of locking up our firearms is so that we can be alert to the warning signs and protect one another. Think about it, like the last bullet. It's kind of like, can I hold your keys? Can I drive you home when someone is drinking and they can't drive? Kind of the same philosophy. Can I hold your firearms? So we want to protect each other and we want to be alert to the warning signs people have, what they're exhibiting. I've had neighbors in my community call me and say, hey, I'm really concerned about my friend so-and-so down the street because they're suicidal and I go shooting with them. So one of the things I've talked to people when I talk to people one-on-one is let's get the firearms either out of the house or into a safe that the individual doesn't have access to. So there's different strategies of and different levels of safety. And definitely the cable style gun lock is one of the simplest strategies. And then taking those keys and making sure that the person in crisis doesn't have access to the keys. So I wanted to put this in here because what if you are the person who's at risk? And if you feel yourself becoming suicidal, protect yourself before it's too late. Take the precautions, ask a friend to hold your guns, take out the firing pins and give the firing pins to a friend. Keep ammunition outside of the house. Do whatever you can to build a strategy of safety that helps you have that time and distance between a gun and the suicidal crisis. So, and again, it's temporary measures until you or the person in your house who's in a crisis are doing better. People will often say, hey, my kids don't know the code to my safe. Your kids know the code to your safe unless you change it and they're not in front of you. My kids don't know my hiding place, or my wife doesn't know my hiding place. People know the hiding places, so you can't expect to just hide the weapon and people not be able to access it. So let's talk a little bit about how we can keep somebody safe. I know in the other sessions you've talked about suicide prevention strategies, and some of that starts with recognizing the warning signs and asking somebody if they're okay, having that conversation. And then, excuse me, once you've had the conversation, if you know they might be at risk, have the chat with them about here's some strategies, changing your in-home storage so that you or the person in crisis doesn't have access, holding the firearms off-site at a friend or family member's house, taking them to a shooting range that offers storage, things like that. So really, I'm kind of looking at that good, better, best strategy with this. And finally, I know I'm almost at time. This slide, I don't love how messy it looks, but I copied this from afsp.org. I'm sure every presentation you've had resources available. One of the best resources is utilizing the 988 crisis line, and you can call or text to the 988. They have a veterans line with that. And then there's some other resources along here as well that will help. And just know that you're not alone. You can talk to, if you or yourself are in crisis, a family member, talk to your clergy, talk to your medical provider, ask friends or family for help, but don't struggle alone, and make sure that you can do what you need to do to make this work, and be safe. And with that, I want to thank everybody for your time. Thank you to Elise for the invitation, and I will turn it back over to you.